So that's a cost, right?
Right.
Okay. The other point here on, because I think all of us are in favor of patient-centered and doctors and patients making decisions, except with one little proviso, which is who's paying for the bill for what they decide to do in the model we're talking about here?
Well, I mean, most of the people that are, in end-of-life care are covered by a government program, Medicare. They may be dual eligibles with Medicaid, but I think, if you start letting government bureaucrats decide on what is the appropriate life, when do we pull the plug? And Obama got into that a bit of a kerfuffle in his speech, which was prior to the September 9th speech, when that lady asked about her mother and her stent being placed. So I think doctors and patients should be in charge of these decisions, and families. And I think that's getting it down to the family level is where it should be.
Yeah, but I mean, I guess what I'm getting at is that somebody's got to, like, a doctor and a patient decides they're going to use an expensive technology. I'm fine with that if that's an economic transaction between the doctor and the patient. But if it requires me, the taxpayer, or me, the fellow in the insurance pool, to also pay money, that's where I'm having a bit of an issue.
Well, Ian, you and I would probably disagree, but certainly I was in London just after Christmas, and the knighthoods, the peerages came out, and Andrew Dillon, who was head of NICE, the National Institute for Health and Clinical Excellence in the UK, was awarded a peerage, and there was a tremendous backlash by patients because NICE, which is somewhat similar to comparative effectiveness research. I'm in support of comparative effectiveness research. What I'm not in support of is if government bureaucrats and a coordinating council of bureaucrats is going to make decisions about what treatments, what drugs, what biologics are cost effective as compared to medically effective. And that's what's happened in the UK. You have NICE making decisions about what is the value of a year of my life as a senior. Is it $45,000? That's about what they say. If a new biologic costs $55,000, then NICE says it may be medically effective for you, but it's not cost effective. And I'm against that kind of decision.